Going inside the issues of our community, this is Local 12 Newsmakers.
The best way for us to really address the naysayers is to stick a shovel in the ground, and that's what we hope to do come December.
Good morning and welcome to Local 12 Newsmakers. For over a decade, visions of a dynamic new development on the banks of the Cincinnati riverfront have danced in the heads of regional leaders and citizens alike. After a lot of sometimes ugly twists and turns, a sustained planning process has been underway for over a year, led locally by the bank's working group in cooperation with an Atlanta-based team of developers. The substantive planning documents and contracts that would allow that magical first shovel of dirt to be turned will be presented within a few days. But as the deadline looms, questions continue to be asked. To address some of those questions, the development team built a new model and brought it to the town this past week to help people visualize what is being proposed. I am joined this morning by two principals of that planning team. First, Bailey Pope, who's the Vice President for Design and Construction of the Harold Dawson Company, one of the key members of the team, and also Trent Germano, who is a Vice President with Carter Real Estate, who has been with the team from the beginning and has been frequently quoted in the newspapers and on television and on this show. We've had clips from you as we've gone along. Welcome to Newsmakers, and of course, welcome to Cincinnati. Let's begin by asking this question. One is, you created, or you brought, let me put it that way, you brought this model to town at this point because of some questions that have been raised in the last few weeks about the scale of development on the banks, on the proposed banks. What is going on here? What, in your mind, does this model show? What does this demonstrate? Bailey?
Well, the model actually existed here in town, and we've engaged a local architect to modify it to show our plan, which is a development based wholly on the original urban design plan that was put together 10 years ago, 7 years ago, through the public planning process here. It's a fabulous plan for an urban neighborhood. The only difference that we've done is that we've enlarged on it. We believe the original program from 7 years ago was based on market studies of what was possible at that time. At this point, we're hoping to capitalize on a nationwide trend towards urban living and create a vibrant urban neighborhood. So what this plan shows is the development of Freedom Way that goes across between the two stadiums in front of the Freedom Center as a retail and entertainment district. The development of the park from the river right up into the edge of the city, and then a mixed-use development that includes residential and office and retail. And
Trent, it's you involved in this. The heights of the buildings that are shown in these models right now, what are we looking at? It's hard to see in a white model like this, but what are we looking at? What kind of heights are we've got here?
Well, what's demonstrated in the model would be a 14-story office building, a 16-story office building, and then a 20-story residential tower. And those are indicative of the heights that could be at the banks. The massing that is shown in the model represents the full build-out that we've requested in our PD zoning of 2.8 million square feet. So this would be the ultimate build-out.
2.8 million in all of the development?
In all of the development. That would be the ultimate that we could do.
Now, one of the things that's triggered the recent discussion is a proposal that you have an option to build out one of these buildings to a height of 30 stories. Is that correct?
Right. There were a couple of driving factors in our plan. We've done mixed-use developments. We've done them together. Carter and Dawson have. And what we've learned that this project cannot be built all at one time. It's going to be built over 7 to 10 years. And we have to have the flexibility to meet market demands as we go. So there's two things that we really tried to do in our planning. One is to have zoning flexibility that allows us to move the various uses around the site as we go. So while we show an office building here today
This would be an office building.
It could be a hotel,
Okay.
or it could be high-rise residential. The other buildings that were shown, while they might be residential in that plan, if we had the opportunity to do an office building, we want to be able to do that. So it's not site plan specific. That was one thing.
Okay.
However, we have density caps for every product type. No more than 1,800 residential units, no more than 1 million square feet of office, no more than 400,000 square feet of retail. And,
So-
and when you add those up, Dan, it never exceeds 2.8
Now,
million.
what is the building that you've suggested increasing the height? Where?
Okay, we have a little.
Well,
I know.
with
I
the-
know you've got
we have a
little
little
thing.
cheat model here.
I know. That's why I'm getting. Let's put that on. That's going to go.
Okay, the point that Trent was making is with the flexibility that we're looking at, it could happen any number of places, but in order to identify the scale that might
So that would
achieve.
take this building up to 30.
Right. So
Now-
that's an example of what a 30-story tower might look like on the site.
And what you're saying is that, in all likelihood, if there was a 30-story tower, that would be for business office use. Is that
Right,
correct?
that's correct.
So if you add, is this an addition of 14 stories? Do I read?
Yeah, if
Yes.
that's a 30-story tower.
Okay, if this is now a 30-story tower, what happens to office space other places? Is this in effect an addition of square footage on top of
and
your
I think
2.8?
I think that's what confuses people. A 30-story tower in today's market footprint for office would be 750,000 square feet. That leaves us 250,000 square feet of office on the site because our cap is 1 million square feet. So if we did one, we do one. We think it's unlikely. The thing is that we wanted to be able to compete in the marketplace. If large users were interested in coming into Cincinnati from out of town or the suburbs, we've seen users leave downtown. This gives us an opportunity to compete in that way.
With something like office space, before you started a building, would you have to have a prime tenant? So the decision to make this either 16 stories or 30 stories, do you have to kind of know what the use of that's going to be?
I would say, Dan, that to do a 16-story building or even a 10-story building, we're going to have pre-leasing.
Okay.
We're going to have tenants.
You're not just going to build buildings.
The cheap model only comes in when we have a large user that is interested in signature space.
Okay.
So it's more of the remote event.
Bailey, there's two sort of questions that are floating around out there about the potential for, well, this, and I think it got triggered with the 30-story proposal. One is sight lines, and whether by doing this you're blocking sight lines here from like the Scripps building or whatever. The other one is whether you're creating so much competition with the central business district that in effect you're bleeding off development from here to there, and therefore rather than this being a plus, it becomes competition. What do you say about those two?
What you wanted to do the sight line?
Yeah, I mean, in terms of sight lines and view
Okay.
corridors, from the urban planning standpoint, we're following the principles of the urban design guidelines that were established for the banks. So as you can see from the model, we've oriented all of the tall buildings perpendicular to the river.
They run north-south rather than this
Right,
east-west.
so that you can still see through the blocks,
Okay.
and so we feel like we're preserving view corridors as well as possible with the prospect of development.
Okay.
Trent, do you want to?
What about the
Sure.
question of competition?
Yeah, I'd like to address that. The existing plan for the banks has 200,000 square feet of office. We've asked to increase that by 800,000 square feet to 1 million. The office is vital for the banks because we need the energy from the office workers to support the retail during the day, and we need the street activity to create vibrancy. And if you talk to urban planners around the country and you look at sites, the office becomes a very critical element of the success of that immediate vicinity. I look at downtown of approximately 14 million square feet, and I look at the people that are concerned, that are sending letters and concerned about this overwhelming downtown with office. We believe from our discussions that the residential is not a problem and that the retail is not a problem. They're strictly focused on office. And I would say it's simply a matter of not wanting competition. 800,000 square feet of office space has a very minor impact on downtown.
Some of the people and companies that have identified themselves as complaining include folks like American Financial Group, Fred Marison, whose company, Marison Development, who owns Scripps and a number of other buildings downtown, Western and Southern, which of course through Eagle Realty is a developer in the downtown. So are you saying to me that you think they're feeling squeezed by this proposal?
Well, I can't speak for
I know.
what they're feeling, but I just
Tell me what you think.
It just seems to me that they don't want the competition.
On the other hand, those are also very powerful corporate partners in Cincinnati.
Well, and that's
Politically, that's an issue.
That's a great thing. I mean, it's a great thing that they are. All we can do is say to Cincinnati that we think this is a great plan. We think it's going to provide a great place for people to be. We need the office, and we don't see that this is a big competitive project with downtown businesses.
I want, a few weeks ago, right the Sunday after Labor Day, I had Roxanne Qualls, the new city council member, on, former mayor. I don't know if you've gotten a chance to meet Roxanne yet, but of course she's been involved back from the beginning. I want to pull one soundbite out from her. Let's listen to this, and I want you to respond.
This current proposal, doesn't deal with the realities, one, of where we are in the market right now. Two, the developer that they are putting forth has no experience at this scale, does not bring any financial contribution to the table.
When you say, okay, what about that? What's your response to that? What about the market issue first? And we all know about residential market, the problem of residential development right now.
That's so interesting, because that comment really speaks to the beauty and the purpose of our plan, which is to create a plan that has the flexibility to adapt to different markets. We started this process with phase one of these blocks a year ago, thinking that we would have for sale housing along with retail as our starter. Well, the for sale housing market is in difficult times right now, but the apartment market is really making a comeback. So we are easily able to switch to apartments and hit that product type. And we think the office can be successful. If we do a 300,000 square foot office building in the first phase, we think that can work. We think we can get tenants for it. We don't know who they are. So we'll do that. And then when we get to the next phase on the next block, it may be that the for sale housing comes back, because it will, because people want to live in this kind of urban environment. And so we can adapt to that change.
Bailey, what about this question of the team doesn't have the experience or the financial resources to make this work?
Well, we have lots of experience.
On this scale?
Yes, this is modest by comparison to some of the work that we're doing in Atlanta right now. We've got two projects in particular. The Carter Company, along with another partner, is developing Atlantic Station, which is what, 58?
Well, we're not the developer of Atlantic Station, but we are working on the project as project managers, leasing management, et cetera. So we've been involved in that project, which already has 2,000.
What about the funding you're bringing to this?
But I want to finish one other thing, Dan.
Okay.
We also have a project in Atlanta, mixed-use project, and a number of the politicians have been there. Ms. Qualls has not been there yet, but we've invited her. It's called Lindbergh City Center. We, Carter Dawson, together have developed 1.9 million square feet of residential, retail, and office use on that site. It's there today, and we did all of it. So to say we don't have the experience to do a project like that is just not true.
Okay.
In terms of financing, which was the other question,
right?
Each of our companies has an equity fund that's a discretionary fund that we use to invest in properties. We match that equity with institutional or private equity, and then we source debt. It's the way developers work. We can finance this deal.
Okay. I want to get in one more point, and I am running out of time, but I want to take a look at an animation that has been put out by the people on the south bank of the river over in northern Kentucky. There's a lot happening over, no, not that one, the animation, let's see, what do we call it? Well, anyway, we'll roll that in. But there's a lot happening on on the South Bank as well. So we talked about the competition over here. The question is, they're already moving over there. I mean, the Ascent, the Ovation, they're moving forward. Is it possible to do this, not destroy Central Business District, and have Northern Kentucky do what they're doing?
Absolutely. You know, if you do something that's good for Cincinnati, and you do something that is good in the market, then it makes this area stronger, and it makes the whole city stronger. And we don't subscribe to the scarcity mentality that some people have, that if you build something, it sucks people out of someplace else. We think you make the whole thing better.
Okay, so it's a growth model.
That's how we work.
One final quick question. How close are we to having the documents that will go to the bank's working group, which once they approve it, then we'll send it to the county commission and city council? Where are we on that? We've been sort of using September 30th with, this is going to air on September 30th. Where are we on that?
The documents will be complete by September 30th.
By the time the show is
That's
on
correct.
air. Okay, thank you very much for being here. This is what I have said on this show many times. This is a very complex issue, complex development. Thank you for your involvement in Cincinnati, and I look forward to having you on
Dan.
as we keep moving forward.
It's
And
our
that
pleasure.
first shovel of dirt that Harold talked about. Stay tuned after the break, a discussion about Hamilton County health care levy, mental health levy.
Thank you.
Thank you, Dan.
Welcome back. We turn now to one of the many issues on this fall's ballot. Issue 28 in Hamilton County is the mental health levy. In 2006, the Mental Health and Recovery Board reported providing mental health services for over 40,000 people, including 11,700 adults, 6,500 children, who received counseling, case management, medication management, and other basic services. Over 8,000 individuals received emergency care and 13,800 received crisis services. State funds account for 26% of the funds to provide these services, while federal funds provide about 31%. The largest single source of funding, 40%, comes from a county-wide property tax levy. The current levy will expire at the end of this year. Issue 28 proposes a $2.99 mil levy, a renewal, and a slight increase. For every $100,000 of valuation, the property owner will pay $43.86. That is an increase of $7.40 for the course of an entire year. To discuss the mental health levy proposal, I am joined by Patrick Tribbe, the President and CEO of the Hamilton County Mental Health and Recovery Board. Patrick, welcome back to Newsmakers. As we were saying, I think we talked about this 5 years ago in this levy.
Yes.
This range of services, and that's a lot of people. That's 40,000 plus people that you're serving. What are some of the most critical services that you really provide? I sort of ticked off the little names, but what are these?
I think the services are basically those that you would expect in a range of mental health services. Services that many are familiar with. Counseling, you mentioned, inpatient care, psychiatric evaluation, medications. Most of the clients that we serve, both adults and children, are fairly seriously ill and quite often come to us in a state where they require an evaluation by one of our psychiatrists. Some may end up in the hospital. Our goal eventually is to try and use some of these other supportive services like counseling, medication management, to have people back in the community where they belong.
The board, the Mental Health and Recovery Board, you're also working with a whole host of agencies, is that right?
That's correct, Dan. The situation with us in terms of our legal status is that we do not provide the services directly. We contract with about 50 providers in our community to provide these services. And these are names of agencies that you're familiar with: Talbert House, Central Clinic, for example, Beach Acres, St. Joe's Orphanage, some of the ones that deal with the children.
And those may be the places that people, those are the names that people really know and whose family members may have connections to and not realize the connection between this levy and their services.
I think that's very true. They don't know that probably 40% of our operating budget, as you indicated, comes from this levy and provides the services that I described. through these provider agencies. And many citizens may not know, in fact, that the Mental Health and Recovery Service Board is there, but we play a key role in terms of bringing those tax dollars to the services to make the service possible for individuals who could not otherwise afford the service.
By the way, traditionally the name has been the Mental Health Board. Now it's the Mental Health and Recovery Board. Right. Why the change?
Well, one of the key changes that we underwent in the last year, in fact it's been a little bit less than a year, our Hamilton County Commissioners made a decision to combine two existing boards within the county. Prior to the change, the Mental Health Board covered mental health issues, mental health resources, and there was an Alcohol and Drug Addiction Board in the community that dealt with alcohol and drug funding, alcohol and drug services. Those two agencies were combined to create the one agency that you described, the Mental Health and Recovery Services Board. It was a good decision. It really helped in terms of consolidating some of the administrative costs.
And therefore efficiency?
Absolutely. We're operating with about 15 less staff than were combined with the total amount before. We've actually been able to put about $800,000 back into services that were previously used for administrative costs in the county.
Okay, so there's efficiency that's been gained
Absolutely.
through this change.
Yes.
It's not just a name change.
Absolutely.
Do some people who get services, do they also reimburse the agencies through their medical insurance plans, through Medicare, Medicaid? Is there also some funding that comes that way?
There is a combination of funding sources in many cases. Again, about 40% is Levy, but the other sources are those that you mentioned. Medicaid is one key piece, that's federal reimbursement.
So that federal figure is reflecting Medicaid?
Primarily.
Okay.
And the state dollars come from our state agencies. There are two state departments, the Department of Mental Health and the Department of Alcohol and Drug Addiction Services, that provide the funding from the state level.
Who's eligible for these services? I mean, is it everybody who you're asking to vote on this is eligible? Is it just low income? What is the eligibility?
The way that our services are set up is that really there is eligibility in terms of income. Everybody can access the services, but if some are able to pay for the services, we will ask them to pay for the services. Mm-hmm. There's really a sliding fee scale, and it's a federal scale that we use. And I think one of the key issues, though, we need to keep in mind is that, especially with our adults, many of these individuals have been disabled all their life. They have very little resources. Most of them come on Medicaid or in a situation where they're unable to pay for services. It's a little different with children, but as you know, with children, still there are not a lot of insurance plans that pay for mental health care, and so the families can get into some serious difficulties in terms of having to pay for very expensive services.
Or the insurance plans may pay for a limited amount, which runs out very quickly.
Yes, absolutely.
And that can be a big issue for a lot of people.
Right.
One of the things that's out there is there's a lot of discussion about the proposal for the jail levy, whatever the official name is, about the services that are going to that, and the number of mentally ill people who end up in jail because we don't have the other ways to care for them properly. Does this help us address that whole issue in this county? Does the money that goes into this levy help address those kinds of issues?
Absolutely. Many of our services in the past have been geared towards individuals who, without treatment, might end up into complications with legal difficulties. And so I think there is some relationship in terms of the two levies. But again, our focus is to try and keep people in the community, to provide community-based services, and to try and keep people out of institutional care. And that's not only jail-based care, but that's hospital-based care. We still have a state facility here in town, and our goal is to minimize the amount of time that people spend in a psychiatric hospital. And that's been very successful. There have been, as you know, considerable changes in medications and other treatments to now enable people to stay in the community and be treated in the community.
We've got less than a minute left.
Okay.
I just want to ask this question. Is one of your biggest worries just the crowded ballot and people won't focus on you?
I think it is a difficulty, but one of the things that we found is that the Hamilton County voters and citizens are very caring people. They have supported the mental health levy through numerous renewals over the past several years, and basically this is a renewal with a small increase to help us really just deal with some of the inflationary costs that are out there. Our services, like other services, have seen considerable increases in cost. This will help us manage the services, and so I'm optimistic that the voters know this service and will support us.
Okay, Pat, I just want to let people know, if they'd like to read more about the agency or the levy, you can check out their websites. One is the agency website, www.hcmhrsb, Mental Health Recovery Services Board.org, or mentalhealthworks.org. Either one of those gives you information about the services and the levy, obviously with the second one. Thank you very much for being here. We'll see you on election night.
Alrighty.
Thank you for making Newsmakers part of your Sunday morning. Remember, this and other Newsmakers interviews are streamed under our website, WKRC.com. Next week, all 4 candidates running for the Cincinnati Board of Education. Have a good week.